Has it ever happened to you that when biting something hard, you felt one of your teeth move slightly? Or when flossing, you noticed a slight mobility that wasn't there before? If you're over 40, what you're feeling could be a very serious, but silent, warning sign. Today we're going to talk about a topic that almost no one wants to talk about: tooth mobility in adulthood. Why it happens, how it starts without you noticing, and most importantly, how you can prevent your teeth from becoming loose or even falling out over time. But let's start with a clear statement: teeth don't loosen because of age, but because of neglect. Aging can accelerate some processes, yes, but it's not the direct cause. There are people over 80 who still have all their teeth firmly in place, and others, at 45, already need dentures or implants. What's the difference? Information, habits, in the moment they chose to take action. So stay until the end, because understanding this could be the difference between keeping your smile or slowly losing it without realizing. First, what does it really mean when a tooth is getting loose? It means that the structure holding it in place, bone, gum, and periodontal ligaments, is weakening. The tooth itself may be healthy, but its support is in danger. And when the support fails, no amount of enamel can save it. One of the first silent culprits is called chronic periodontal disease. In other words, the constant and progressive inflammation of the gums. Did you know that more than 70% of people over 40 have some degree of gum disease without knowing it? It all starts with mild inflammation. The gums look a little red, sometimes bleed when brushing. Nothing serious, right? Wrong. That's exactly where it begins. When untreated, bacteria start invading the space between the gum and the tooth. That small gingival pocket, which should be clean and tight, becomes the perfect cave for bacterial growth. And those bacteria don't just cause bad breath or bleeding, they start destroying the bone. Yes, the bone that holds your teeth. And the problem is that when that happens, it doesn't hurt. That's why many people only find out they've lost bone when it's already too late. Now let's add another silent factor: bruxism. That involuntary habit of clenching your teeth, often while sleeping or during stress. After 40, chronic stress and sleep disorders are more common, and many people clench their teeth without realizing it. And what does that have to do with dental mobility? A lot. Because that constant microtrauma on the teeth creates intense pressure on the bone and the ligaments that support it. And if that bone is already weakened by chronic inflammation, the result is a recipe for disaster. The teeth begin to move. Another frequent culprit is dry mouth. As we age, many people, especially women during menopause, begin producing less saliva. And saliva doesn't just moisten your mouth, it's the first line of defense against bacteria. Without enough saliva, the mouth's pH changes, bacteria multiply, and inflammation skyrockets. And we can't ignore modern diets. If your meals are based on ultra-processed foods, refined flours, and simple sugars, you're not only feeding your body, you're feeding the most destructive bacteria in your mouth. They love sugar, and the more you feed them, the more acid they produce. More acid equals more destruction. But here comes the part that few mention: tooth mobility is not 100% irreversible. In many cases, it can be stopped, stabilized, and even partially reversed. So, what can be done? Here's where the practical solutions begin. Get a professional deep cleaning at least once a year. We're not talking about a quick 10-minute cleaning. We mean a proper scaling and root planning if you already have periodontal pockets. This cleaning removes bacteria under the gum and helps tissue regenerate. Brush like your dental future depends on it, because it really does. Use a soft bristle brush with the correct technique. It's not about strength, it's about consistency. Brush along the gum line with gentle circular motions, and do it 3 times a day, not just in the morning and at night. Flossing is not optional. The most dangerous bacteria live between your teeth, where your brush can't reach. If you don't floss, you're leaving half the job undone. Do it at least once a day, even if it feels awkward at first. Use mouthwash specifically for gums, not just any TV ad rinse. Look for one without alcohol, preferably with chlorhexidine, if recommended by your dentist, or natural anti-inflammatory ingredients like aloe vera or tea tree oil. Consult a periodontist if you notice mobility. They specialize in gums and bone support. They can do a full evaluation, measure periodontal pockets, and determine if you need a more advanced treatment. Manage bruxism. If you suspect you clench your teeth at night, talk to your dentist about a night guard. And if stress is driving the issue, consider techniques like meditation, yoga, or emotional therapy. In the first part, we talked about the silent causes that can loosen your teeth after 40: periodontal disease, bruxism, dry mouth, bone loss, poor hygiene, and a pro-inflammatory diet. I also showed you basic actions to stop this process. Now let's go even further. Because taking care of your teeth isn't just about brushing better, it's also about nourishing your body from within, supporting the bone that holds each tooth, and avoiding habits that sabotage you without realizing it. And here's the first key point. What you eat shapes the health of your mouth. We're not just talking about avoiding sugar, although yes, it's crucial to reduce it, but also about feeding your body what it truly needs to maintain strong bones, resilient gums, and bacterial balance. Did you know, for example, that many people lose teeth because they have a vitamin D deficiency and don't know it? Vitamin D is essential for calcium absorption. Without it, you can drink all the milk in the world and still lose bone mass. And the alveolar bone, the one that supports your teeth, is one of the first to be affected when there's a deficiency. That's why, if you're over 40, ask your doctor for a vitamin D test. It's simple and could be the difference between keeping your teeth or not. The same applies to vitamin K2, magnesium, and collagen. K2 helps direct calcium to the bones and not to soft tissues. Magnesium is essential for bone density and muscle relaxation, something important if you suffer from bruxism. And collagen is the structural protein that supports the ligaments holding your teeth. And what about food? Here's a practical guide. Include more calcium-rich foods: broccoli, almonds, sardines with bones, sesame seeds. Consume healthy fats. Cholesterol is a precursor to hormones necessary for bone health. Don't fear avocado, olive oil, or eggs. Reduce acidic and ultra-processed foods, sodas, commercial juices, cold cuts, cookies, and white bread. All of these disrupt mouth pH, feed bacteria, and demineralize enamel. Drink enough water. A dry mouth is a paradise for bacteria. Hydration is key for producing enough protective saliva. And now something few people know. Gum exercises exist. No, we're not talking about lifting weights with your jaw. We're talking about conscious gum stimulation. Massaging your gums with a soft toothbrush or your clean finger improves blood circulation in the area, which helps regenerate tissue. You can also use an oral irrigator, water flosser. This device sprays pressurized water to deeply clean between teeth and inside periodontal pockets if they already exist. Many patients with tooth mobility see significant improvement after using it once or twice a day. And what about stress? Stress is a silent enemy of your oral health. It increases inflammation throughout the body, worsens periodontitis, causes bruxism, dries out the mouth, and distances you from self-care. If every day you feel rushed, anxious, with a tense jaw, it's likely that, without knowing, you're creating microtrauma in your teeth every night while you sleep. That's why I'll say it clearly. Relaxation isn't a luxury, it's treatment. Dedicate at least 15 minutes a day to deep breathing, silent walking, meditating, or simply disconnecting from mental noise. Your jaw will thank you. Your gums too. Another powerful yet rarely practiced habit. Check your sleeping posture. Sleeping face down or with your head turned for many hours can compress jaw tension zones. Sleeping on your back with proper neck support helps your facial muscles relax better. Now let me share 5 warning signs you should never ignore. Gums that bleed frequently when brushing or flossing. Persistent bad breath, even after brushing. Pressure or discomfort when biting. Changes in tooth alignment. They start to separate or slightly rotate. A feeling that something is loose when eating or biting. If you have one or more of these signs, don't wait. Schedule an appointment with your dentist, or better yet, a periodontist. The earlier the problem is detected, the more chances you have to save what can still be saved. And I want you to remember this strongly. Losing teeth is not inevitable. Age is not a sentence. It's a stage that requires a different kind of care. Many people after 40 stop caring for their mouths because they think, what's the point if I'm going to lose them anyway? And that's not just false. It's tragic. Because keeping your teeth isn't just about aesthetics. It allows you to eat better, speak better, smile without fear, sleep without pain, breathe better, and yes, live longer with more quality. So if today you notice that one of your teeth moves slightly, don't panic, but don't ignore it either. That small warning could be your chance to truly start taking care of yourself. This video isn't meant to scare you. It's to give you real, applicable tools backed by science and experience. Because there's still time. Time to reverse, to strengthen, to protect. Thank you for being here, for listening to your body, for wanting to learn. And if you know someone going through the same thing, a friend, your sister, your mom, share this video with them. Sometimes a conversation at the right time can save more than just a smile. See you in the next one. Your mouth, your health, and you're worth it.